Okay, so welcome to Birth and the Newborn Infant, Stage of Lifespan Development. We're going to be talking about this. Again, we're not going to just be reviewing the chapter. We're going to talk about some different things that come up and some different topics that are unique to this stage or centered primarily in the stage. Okay, so midwives, right? We can't really talk about this topic without talking about birth, right? It's part of it. So midwives are something that have been making a resurgence recently. They were the primary way that children were delivered through most of civilization, depending on different cultures and such, but very, very, very pronounced. Some cultures call them different titles. And then they kind of died off when medicine, the current, what we think of as modern medicine, really took center stage. And then they came back. And they're experiencing a very profound resurgence right now. So we're going to talk a little bit about midwives. For some of you, you may be really familiar with this topic. Some of you may be like, you've really never heard this topic at all. So again, it's rising again in popularity in developed countries, right? So here we can see that this is how many, what percentage, right, have used them. So in the U.S. in 1990, 3.9% of births were assisted with midwives, but in 2014 it was 12.1. So that's a pretty significant change, and not a great deal of time. That's a pretty short period of time to see such significant change. There are lower mortality rates associated with midwife care. So something that's interesting story. This is true. You guys can research it. It was in Scotland in the 1800s, and physicians were trying to really encourage women who were delivering to come and deliver at the hospitals. But they actually found that the mortality rates were drastically lower for people who still use their midwife and delivered in their own home. So physicians were trying to say, no, deliver in a hospital, it's safer, it's safer, it's safer. But it wasn't. Infants in the hospitals were dying at far greater rates than they were at home delivered by midwives. And they found out, of course, as things developed, that one of the reasons was because the physicians would go straight from the morgue or from people who had infectious diseases and come and deliver the baby. So the very first thing the baby was being exposed to was oftentimes deadly pathogens. And that was not something they were exposed to in their home environment. So midwives have been traditionally associated with lower mortality rates. And then here, mortality was 19% lower with midwives versus physicians. Neonatal mortality, so new birth, so newborns, was 33% lower, and low birth rate delivery was 31% delivered. Birth weight probably is what they should say. But so what we're seeing is that it significantly reduces a lot of risk factors and significantly reduces mortality. So if you are pregnant, if you know somebody who's pregnant, if you love somebody who is pregnant, a midwife is a very time-honored and now research-driven, approved and safe thing for the safe delivery of a child. So the research is just very emphatic. Midwives are wonderful things. They make the whole birth process safer. They make the child safer. So if a pregnancy and birth is in your future, look up who your midwife is going to be. Don't just rely on a physician. And hand in hand with midwives often go doulas as well. Doulas are wonderful. They're non-medical, but what they're all about is the support for the mother. And doulas are also associated with much higher rates of satisfaction for the mother, quicker recovery time, bonding, better breastfeeding connections. So doulas are just something else that I also highly recommend midwives and anybody who I know is pregnant. I highly recommend they look into getting a midwife care. If their practice is only physicians, look into midwife care, and then having a doula. And a doula is something you can have regardless of the practice that you're in, that you're working with for your delivery. A doula is something you can have, and doulas are really just not that expensive. And it's starting to be that more and more insurance plans are starting to cover doulas because it's being so well established in the literature that they help health. Hospital stays are shorter. There's less bleeding. There's all these complications that are reduced with doulas. So insurance companies are starting to pay for them. And then medical costs versus gains in socialist countries. So this is something that is an interesting, kind of interesting like political way to look at it, right? If you look at socialist countries, they dictate, like Switzerland or so, they take about 80% or Sweden, they take about 80% of each individual's income to use it for, the paying for everything. So you keep very little of your own income. For every $100 you make, right, you get to keep about 20 of it, and they take the 80%, and then they make different choices. Well, they are really looking at midwife too. So some of those countries have been the biggest countries to adopt midwife care because they're recognizing that it's a good medical cost. And so then, right, we just see this. So these are some. So Norway, you have up to 79%. Denmark 60%, Sweden up to 60%. So these are other just socialist countries and their tax rates. The country makes the definitive medical decision. So if a mother gets one care versus another, that's actually not a decision she gets to make, because right when you give away 80% of your income and the government has the power to pay everybody's medical bills, it also means they get to dictate everything you get. So a lot of times people say, oh, it's so great they pay your medical bills. Well, they pay your medical bills because you already gave them all your money. So it's not like you get your money and you get free medical care. No. You paid for the medical care already. And one of the things about that is that because your medical care, you gave up your money for then the medical care to be paid for through your funds, but through the government, it means you don't have a say in your medical decisions. A lot of times they just decide what the case will be. So that's something that is entering midwife care too. And they're starting to be contentions. Think of if, can people get the care that they want? And the answer to that question is no. So there's going to be some pushback to that too. So something new that has been, it seems new to us in the grand scheme of things. It's really not. So there's an old legend that Caesar Augustus, I think, was delivered by a C-section. It doesn't really seem like that's probably true, but so C-sections have been around for a while. They have only become pretty common fairly recently. And I attached this picture. I know it's kind of anatomical. Sorry, some of you who have weak stomachs, but I did want to say, so this is not the way that a C-section is done typically anymore. This would be a vertical scar. Typically nowadays, C-sections are done horizontally. They're much better for a lot of different reasons. The reason I still included this, however, is because if any of you are watching this and you were delivered by C-section, the chances are great that you were delivered this way with a vertical incision. Horizontal incisions are used almost all the time nowadays, but that's actually only been a change that's been around for about the past 20 years or so. So some things to know of these C-sections, right? C-sections means there's no passage through the birth canal, right? Because the baby is delivered through the mother's abdomen wall. There's something called a cascade of intervention. A cascade of intervention means that whenever there is one medical condition or one medical intervention that is used, it means there's more and more likely for other medical conditions to be used. If you do one thing, then another's probably going to be needed, and then another's probably going to be needed, and then another's probably is going to be needed, and then on and on and on. That's what a cascade of intervention stands for. You might want to make sure, hint, that you can define that term, cascade of interventions. And again, cascade of interventions applies to whenever one medical intervention is used, it makes it more and more likely that another one will be needed, and then another one, and another one, and another one. So if you can stop before you need any medical intervention at all, you'll be much better suited than even needing one, because even needing one will set you up for another, and another, and another. So if at all possible, you want to try to make it so you don't need one, right? That goes back to prevention, right? An ounce of prevention is worth a pound of cure. Sometimes it's not possible. That's absolutely true. For children who have, or adults who are delivered by C-section, they're actually 5 times more likely to have allergies. I thought this was interesting. I wanted to include our little C-section talk. And one of the reasons that they suspect for that is because there was no passage through the birth canal. So all the good bacteria and all the different things that they'd be exposed to in the birth canal, they're not exposed to in birth. Asthma, they have 20%, their rates of asthma are 20% higher than those delivered vaginally. And then, of course, the gut flora impact. And gut flora impact is directly tied to the birth canal, because that is where the the bacteria, the good bacteria from the mother, is passed on to the child, and it's one of the first ways of really cultivating the child's gut flora. And if anybody knows anything about gut flora, that is hugely important to not only your gut health and your abdominal health, but also your physical health and your mental health. It's being linked more and more to mental health and a lot of mental capacities and things like that. The Chinese have often called the gut the second brain, right? We kind of devalue the gut in Western culture, but a lot of other cultures do not devalue the gut, and they see it as the second brain. And then just some interesting things to think about are, what are the consequences of huge rates of people being born via C-section if it has all these effects on an individual, if we're starting to see more and more and more people delivered by C-section. And of course, about 30%, 30 to 50% of births nowadays take place via C-section, even though it's estimated that only about 10% need to take place via C-section. So there's a lot of, kind of hair trigger reaction on the part of physicians and the medical community, just get in there, get a C-section done, and not as much concern for all of the cascade of interventions that follow. Now, absolutely, sometimes a C-section needs to happen. That's not at all what this is about. This is about how this is new, this is relevant to what's going on with us, and kind of a new generation of people who a very good percentage have been born via this method that is new and that has effects, significant effects. So it's something that we want to think about and keep track of as we're looking at this lifespan section and stage. Especially, again, we always want to look at lifespan stages, keeping in mind how they are changing, how they're different now. And this is certainly something that's different now. This would not have been the case 50 years ago. So we want to think about it. We want to be aware of it. We want to look at what the possible impact could be. Okay, so infant mortality. Just a couple things about infant mortality. We hear a lot about infant mortality. This is certainly not a happy topic, but I want to talk just a little bit about it because this is something that's brought up in the textbook, and it is something that is talked about quite a bit in this stage of lifespan development, and I think it's important just to understand exactly what is meant. Okay, so when we think about the infant mortality rate, something to consider, as some of you may have heard, is the SAD, right? And that SAD stands for Standard American Diet. So one of the things we want to consider in our country is, how is infant mortality rate affected by the Standard American Diet, by what we eat? 63% of calories come from refined and processed foods, right? So that's part of the Standard American Diet. 63%, right? That is a significant impact from refined and processed foods, which means that most of people's diets is coming from refined and processed foods. 25% of calories come from animal-based foods. 12% of calories come from plant-based foods, but 6% of those are French fries. Right, so this means 6% of calories from the whole American, right? So this is going to differ from person to person, but 6% comes from actual vegetables, right? Okay, now SIDS, sudden infant death syndrome. So a lot of you have probably heard about this. A lot of this is not known. There are some things that we know that are related to SIDS. Some things that are more associated with SIDS. Living in the house, the baby being in the house of a smoker, whether it's the mom or anybody, that greatly increases the risk of SIDS. There are some other things that greatly increase the risk of SIDS. Alcohol use on the part of the mom, things like that. We know that those things just definitely increase the rate of SIDS. But there are other things that we don't know. So if you do know anybody who's pregnant or having a kid, definitely encourage them. Don't drink, don't smoke. When the baby is born, you want to make sure that you do things in a way that is always allowing them to breathe, never constricting them, never forcing their head in a certain position or a certain direction. There are some baby mattresses you can get for cribs and such that are completely breathe through. I've actually stuffed my head in the mattress, and it's amazing because you can literally breathe through it. It's called one of them I'm thinking of is called the Newton mattress, like Isaac Newton. It's called the Newton mattress, and it's formulated in such a way as all these little safe plastic, I don't know how to describe it, but safe plastic lines that don't have toxic chemicals being leached from them, and so it's completely breathable. So even if the baby's head was just face down in the mattress, they would still be able to breathe through the mattress. There are differences in the mortality rate for races, and this is true in America, and this is true for other countries where there's different races in the same country. So that's an interesting thing to consider, and where those differences in infant mortality rate come from. Is it lack of education? Is it part of the culture? Where are some of those differences from? And then this is just something I'm kind of throwing in there because there are some different countries that consider born differently. Some people consider if they've actually been born and they're born alive, then if they later die, they're part of the infant mortality count. But if they're actually dead when they're born, they may or may not be count. Some countries consider people to be born just because they get to, I think, like 38 weeks gestation. So it's one of those things, like we may think of born as being black and white, but sometimes if different countries consider what is born, who was born, and who is not born differently, that can skew their infant mortality rate. So if something becomes an area that you're really interested in, one of the things, and you're comparing different countries, one of the things you want to keep in mind is, okay, what's the definition of born? Okay, so again, these are just kind of some pieces. I think the infographic is nice just to kind of, make it easy to digest. In the early 2000s, 60% of all middle and high schools sold soft drinks in vending machines. I personally don't think that this is a big deal for kids that age. One of the concerns to me, however, is that kids might be just used to this just being all the stuff they drink. Middle and high school kids, if they have a soft drink, every few days, that's and they're drinking water and eating healthy, it's not that big of a deal. I wouldn't really want my kid to do that, but it's not that big of a deal. But one of the things that we're seeing is this is the only thing kids are drinking. They're not drinking water. Americans spend 10% of their disposable income on fast food. Again, that's a huge percentage. Processed foods make up close to 70% of the U.S. diet. It means very few people are making their own food from scratch. The average American consumes 130 pounds of sugar per year. That's like how much a grown adult female weighs. Right, an average American consumes 130 pounds of sugar. Yeah, that's amazing. So, and something else that I think is interesting is, traditionally, I think I read that that people expected to spend about 50% of their income on their food because they very, very much valued food. Well, nowadays in America, people expect to only spend about 10% of their income on food, meaning we just want cheap, plentiful food. And a lot of Americans at large are not willing to spend the money that quality food takes. And interestingly enough, it's not necessarily socioeconomic. It's not like, oh, the poor people can't afford it, or oh, the rich people can, and no, it's not really about that. Because you can eat healthy and very, very cheaply. Very cheaply. So it really has more to do with education and care. People who value food, no matter how much annual income they make healthier food choices. People who don't really value food, people who just see it as something to fill up their bellies, no matter how much money they make poor food choices. Okay, so this is just another thing that I thought was interesting, another chart. At-home spending patterns of U.S. households are not in sync with USDA food plan recommendations, which I thought was interesting. So the yellow represents the recommended, and the blue represents the average for U.S. households. So here, let's look at whole fruits. That's what's recommended. That's what the average household does. Refined grain. So that's what the average household does. That's what's recommended. So this is increased sugar and candies. That's what's recommended. That's the average household. So there's a pretty big discrepancy. Okay, so another thing we're going to talk about, and this is an important topic to talk about in every life stage, I would say. I think it's important to talk about in this section because the mother is at such a vulnerable state, and she's taking care of somebody in such a vulnerable state. So we're just going to cover it here. We will touch upon it in other life stages as well. Okay, postpartum depression affects about 10% of new moms. That's a pretty significant number. Signs can be they withdraw, change in eating, physical symptoms, over or under sleeping, continual crying, and anxiety. And if anybody's ever had a kid, you know that these are not terribly unique symptoms for anybody who has had a newborn. So it's kind of hard to be able to recognize, okay, who's suffering from postpartum depression, who's just has a newborn and they're not ever sleeping and they're so out of their minds crazy tired that these are some things that are manifesting. I always encourage people, you know what, it's better, be that extra supportive person, monitor them, talk to them, learn about their inner thoughts so you can learn about what's really going on. So the baby blues affects about 80% of new mothers, and that's mild, and it's gone in 1 or 2 weeks. Postpartum depression is not the baby blues. Again, baby blues affect about 80% of new moms, and it's usually pretty mild, and it's usually gone within a few weeks. That's what the term baby blues is generally meant. Postpartum depression is much more than the baby blues. Postpartum depression is very serious, and it can escalate in seriousness very quickly because of how much is being asked for from the new mom, and then how much the new baby needs. So again, it can escalate very seriously because the mother is usually already at a severe deficit with food and sleep and any ability to do anything or concentrate on anything else. And then there's also this other creature, this baby, that needs this mom who's already kind of incapacitated, but needs, and this baby's needs are not going to stop. So it's very important that postpartum depression is addressed early on, is observed, is treated, and that it's people that love somebody suffering from postpartum depression come along and really support and uphold them and help her and help the new baby and really just give them that support and that care. Some indicators that postpartum depression is going to be more likely is a previous history of depression, a family history of postpartum depression, or instability after the birth. Now, sometimes the instability could even sometimes be not a bad instability. Like maybe they're moving to a bigger house after birth or something like that. So instability that's negative is certainly going to be, a much more likely cause, but instability, it doesn't necessarily have to be a negative instability, but something changing, something requiring a lot of care and attention, a change, a readjustment on top of all the readjustment, all the changes and everything that already need to happen after the baby's born can just increase the likelihood of postpartum depression. So the ideal method of treatment is not medication for many, many reasons. Breastfeeding, getting in the milk, dealing with all the fact that the hormones are already horribly wonderfully out of whack, doing a whole bunch of biological necessities at that time. So it's very, it's usually the last resort to treat postpartum depression with medication. It's super not ideal. So the ideal treatment of method is professional counseling, and it's usually very effective. It's also usually very helpful to have somebody come in and assist with sleep coaching or something for the baby. And now, absolutely, postpartum depression is not just sleep deprivation. That is absolutely, it's not just, you'll feel better when your baby sleeps more. But something to consider is that sleep deprivation is making it more and more difficult for your brain to work on the postpartum depression. So it's not like, the problem is just your baby sleeping and then you'll be fine. That could be, but it very well may not be. But once your baby is sleeping a little bit better, that gives you a little bit more resources to deal with your postpartum depression. Okay, so care for the newborn and the infant. The power of touch. Those of you who have read the chapter, which should be all of you, on skin hunger, you know about this. You know about the amazing power of touch. You can see children lose weight, gain weight, increase in intelligence. You can see all of these amazing things connected to the power of touch. A lot of times in our society now, the word touch is kind of a bad word, and that's very unfortunate because certainly there is bad touch out there, but there's so much more good touch. And good touch is literally necessary for survival. Babies need to be touched. I'm sure most of you have heard of kangaroo care, read about it. Skin-to-skin contact, being held against the parent's chest, skin on skin, baby on skin of parent. This is incredibly helpful. If you've ever been in a NICU or something, this is something that's that's vital to their treatment. All babies need it, especially babies who are very little. They really need that skin on skin contact. Massage and release of hormones, right? We can see that the release of hormones promotes weight gain, muscle development, and ability to cope with stress. And again, I'll put this link up for you guys so you can watch this little video. So touch is important. Okay, so these are some other things, some other videos for you guys to watch about Romanian orphanage, animal adoption, and different babies. One of the things I want you guys to keep in mind is Harlow's monkey, right? Remember the bottle with the wire monkey mommy and the soft cuddly mommy that had no milk, and the wire monkey that had no mommy that had no comfort offered milk, but the mommy that offered comfort hadn't. The mommy that offered comfort had no milk, but the wire monkey did have milk. And what that experiment showed, what was super surprising, hint, hint, about that experiment, was that the baby actually preferred the comfort over the food. Right? The baby would go and get the food from the wire mommy, but go right back to the cuddly, soft mommy. And so what this really shows, and this is really groundbreaking, is that the number one important thing to that baby wasn't really just survival, wasn't really just getting enough food to survive, or else that baby monkey would have just hung out the wire monkey. That baby monkey really needed comfort more than food, right? That's what the baby monkey chose, comfort over food. So very, very interesting, and really changed the way we thought about developing children, helping nurture children, comforting children. Okay, so these are some references that I utilized. I went over a lot of little factoids and such. These are some references for you guys to look up if you're interested in learning interested in learning about any of the topics that I brought up.